To access field notes and ITERs, which stand for In-Training Evaluation of Rotation, you can go to the DFCM homepage at dfcm.utoronto.ca and click Login in the top right corner. Here you can log into field notes using your UTOR ID and password. For an in-depth look at using field notes, please speak with your PD rep at your site about referring to the Fun with Field Notes workshop and resources. On this login page, you can also access Power. When it is time for you to complete an ITER for a resident you are supervising, you will receive an email from PGME Evaluation Program. You can use the internet link contained in this email to log on to the Power system using your Power ID and password. Once in Power, you can click on Tasks and then Trainee Eval to see a list of the resident evaluations that need to be completed. ITERs are organized by the CanMed's FM roles, so Family Medicine Expert, Communicator, Collaborator, Professional, Manager, Health Advocate, and Scholar. ITERs also reflect the learning outcomes of the DFCM's competency-based curriculum. ITERs reflect different levels of training by evaluating different objectives at the PGY1 and PGY2 levels. ITERs assess level of competency for a particular objective on a 5-point scale, from 1, unacceptable, to 3, at level of training, to 5, practice ready, or PGY2 ready in some instances. There are specific descriptors of the levels of competency for each of the objectives. Based on the PGME guidelines for ITERs, there has been an important change to the overall assessment of a trainee. A score of 1 or 2 overall is now a failure of that rotation, and this sends a notification to the DFCM program director. It is important to note that there is a key difference between being unacceptable, so scoring 1 or 2 on a certain objective, and not passing a rotation. Depending on a resident's level of training, they may not yet have achieved a particular competency, but if overall they perform at a reasonable level for their particular level of training, they can still successfully pass the rotation. As an example of how to use ITERs, consider the resident in video case 3, newborn visit. If you were the preceptor evaluating this PGY1 resident, and the resident's performance in this visit was consistent with their performance throughout the rotation, your completion of the ITER could indicate under Family Medicine Expert that the resident was unacceptable at taking an appropriately thorough history in a timely manner. So they rarely elicit an acceptable history of presenting complaints and rarely identify pertinent associated symptoms, red flags, and risk factors with a score of 1 or 2 on this particular objective. Similarly, for the same resident, under Communicator, you could indicate that they are at a practice-ready level when it comes to adopting a patient-centered approach, so they consistently determine the patient agenda and illness experience, consistently balance patient needs with desired treatment outcome, and consistently develop mutually agreeable treatment plans with a score of 4 or 5 on this particular objective.